Morning, Facebook and KRK.com, Fox16.com. I'm Mitch McCoy just after 11 o'clock here in Little Rock, and I don't want to waste any time because we have UAMS on the line, and we know that all of our healthcare professionals are so incredibly busy right now. Heading over to UAMS, we have Dr. John Udique from UAMS, and Doc, I want to let people know that they can ask questions during the Facebook Live using the hashtag #HeyDoctor, #HeyDR, and you see that there at the bottom of your screen. So, Doc, tell me a little bit the overall assessment regarding Thanksgiving and the holidays. What do people need to know?
I think some things we need to know is COVID is still spreading currently, and we want to do the things that we can to be as safe as possible. If you can't, or if you're able to not travel and stay home this holiday, we would recommend that. If you are going to travel, things like wearing a mask when you stop at a gas station, both when you're pumping and when you go inside. I would recommend having hand sanitizer in the car with you so that when you touch the gas pump, you get in the car, you clean your hands, and make sure that you try and stay away at least 6 feet away from people when stopping on the way to your family member's house.
Very interesting. And we've heard a lot of people talk about Thanksgiving. We've heard, and it just seems like there's mixed messages. I mean, okay, if you're going to go and do a small family gathering, here's what you need to do. But then you have Arkansas health officials saying, don't do a family gathering. Is that more of that other messaging we're hearing? Is that more of just a backup in case people, kind of do what they want to do?
So we want to make sure that everyone stays as safe as possible. But I also understand that this is a time that we want to see loved ones, and this is tradition, and we do this every year. And if you want to see your family, and it's been a year since you've seen them, or maybe someone you're not sure how much longer they'll be with you, and you want to be a part of this last year with them, we want to do everything we can to stay safe. So if you're able to stay home, I would stay home. But if you are going to go, then we need to be as safe as possible while traveling.
Some good advice there. And it's interesting. A few weeks ago, I took a flight, and I was wearing two of the surgical masks. So, I mean, worst case scenario, if somebody has to fly, I mean, mask up. I mean, wear two masks, wear three, wash hands as much as possible, and try and do the social distancing where you can, especially in an airport.
So absolutely, staying 6 feet away from people at the airport. It's when you're waiting for your flight, don't sit directly next to someone. Make sure you're washing your hands frequently. If you're touching the seats or other things at the airport, clean your hands before you touch your face or try and blow your nose. As far as wearing 2 or 3 masks, you can wear an N95 mask, which is the ones that we wear at a hospital. That's going to give you the most protection. But you can also wear a surgical mask or mask that you buy online, just as long as you have something to try and cover your face to filter some of the air that you're breathing in, and most importantly, to protect others if you do cough or sneeze, so that we're not spreading those particles throughout the air.
Well, and there's just so much, especially with this virus. I mean, it seems like very early on we were told one thing, now we're being told another, and that's because science is evolving, a lot of those health experts say. So I want to add a comment to the queue here, and this is going to be Barbara, and I'm blind, so I have to squint and see these questions. Let me throw up Barbara's question. Barbara's wanting to know, and she's using the hashtag #HeyDoctor, #HeyDR. Barbara wants to know, what if you just wear a mask? If you wear a face covering and you were to go to a dinner, I mean, that seems like, if I remember correctly, that would still be considered a high-risk category depending on the number of people.
So it depends on where you are and the number of people. If you're in a small room with a large number of people and poor ventilation, then that's going to put you at a higher risk rather than wearing a mask, going and sitting outside on a patio, and at least having good air circulation to try and keep you safe while you're breathing. You're not just breathing each other's air. And that's the point, is to try and limit the amount of contact that you have with other people to prevent the spread of the disease. Just in case that you happen to be an asymptomatic carrier, you might pass it along to someone else if you're sitting right next to them.
So we're looking at video of airports and traveling on the screen right now. Traveling in a car, especially given, when you were talking just a minute ago about air ventilation and things like that, Traveling in a car with several people in that car seems like a high risk situation for the holidays.
Yeah, so the thing with the airplane is you do have that circulation that's being filtered by their HEPA filters, which is good. But in a car, usually the people you're going to be traveling with are family members. So those are people that you're exposed to daily. And it's not necessarily 30 or 40, 50 or 100 strangers from an airport, right? So if you're with mom, dad, brother, and sister, well, you're with them every day. So the risk of you guys exposing each other to something new is a lot lower than surrounding yourself with thousands of people at an airport.
Very interesting, very interesting. So I'm looking at a comment coming in right here, and I'm going to go ahead and bring up this, and this is going to be Kate's question. Kate's using the hashtag
Okay.
#HeyDoctor. And feel free, folks, and I'm trying to watch as many of your questions come in. We're specifically talking about the Thanksgiving holiday and COVID-19, and we have Dr. John Udique here from UAMS, who's going to help us walk through and try and understand the madness regarding COVID-19 and the holidays, because there's a lot out there, and we need to know what's factual and what's not. So feel free to use that hashtag on Facebook Live here. We'll try to get your question answered. But Doc, Kate wants to know, when will this end? Will it end? Because that's what so many people are thinking as we go into the Thanksgiving holiday. They're thinking, oh, we're missing Thanksgiving. We're missing Thanksgiving with our loved ones. Kate wants to know, when will this end? Will it end?
Well, I think that's the $1 million question, right? And we don't have a date that, next year on this date, this will be over. But the goal is, if we can mitigate the amount of transmission, it will end sooner. So the more diligent that we are, and I know we're all fatigued, the whole world is tired of this, and we want to be able to move on. But if we can really just put our nose to the grindstone, keep doing what we're doing to try and stay safe, to try and limit the amount of people who are getting sick, eventually we will be to a point to where we can go back to some sense of normalcy.
Well, let me get to Russ's question here. So, and this might be a complex question. Feel free, and probably important to point out that you can't really give medical advice over Facebook, and people should probably contact their family care doctor or contact.
You can come see us at UAMS. We're in the family medicine clinic.
Yeah, the UAMS. You're in the family medicine clinic.
I'm in family medicine. You can come see me directly.
There you go. So we'll have to throw that out here in a minute, because a lot of people are asking some of these direct medical questions. But Russ wants to know, and he's using the hashtag #HeyDoctor. We have created a 3-family pandemic pod. We only do required outside trips. Our kids keep sharing colds and such. Is it fine to treat this as our direct family? Or do they need to give you a call, or what's your advice to them, especially over the holidays?
I'd say, for a general answer to that question, if you're only exposing yourself to a certain group of people, then that's great. Then that makes you low risk, because you have your own little bubbles, right? So if you can keep with your family within those bubbles and limit the amount of exposure that you have going outside of that, then that's going to drastically lower your risk than to have families who you don't hang out with frequently, who may be interacting with hundreds of other people and then coming into your circle. So by keeping your circle small and tight, that's going to make things a lot safer for you. Now, it doesn't mean you can't get sick, but it does lessen the risk, and that's what we're trying to do here.
So could Russ still, could Russ, because he's created this family pod, Russ could still go out, he could probably get Thanksgiving dinner, and there's no concerns, as long as it's that direct family?
So I would never say that there's no concerns, right? Because this is a virus. This is invisible. We can't see it. So you don't know when you're being contacted by the virus, and that's why this is spread everywhere, because we can't see it, right? So again, just to limit the amount of people that you're around, to do the things like wash your hands frequently with soap and water for at least 20 seconds, to wear your mask when you're in public places, and keeping a small knit circle is going to be incredibly helpful for you to lower your chances. I can't ever say that it's going to be zero, but if you can go from, man, I'm having direct contact with no mask and not washing my hands and I'm exposing my family, to we very rarely interact with other people except for the select group, and we're all diligent, then the chances of you getting sick is significantly decreased.
Well, and that's why you're wearing the white lab coat, because you're the doctor, and
I got my mask right here too.
Your mask, yeah. Okay, so next question coming in. Joyce is using the hashtag #HeyDoctor. Joyce wants to know, does an air purifier help placed throughout the home? This is kind of an interesting question. Not sure if she plans on having a gathering at her home, but what's your take on this?
I don't know if I can comment on a specific purifier. I know that the airport industry is saying that they have the HEPA filters in their planes that help filter the air out. But again, it's going to go back to staying distant, keeping the number of people that you're around limited. And it doesn't mean that trying to clean your air isn't helpful. But I also don't know what type of air filter you're using. Does it stop a certain particle from getting pulled back into the air or not? I just can't answer that directly.
And again, because and maybe and this, I'm just taking a wild guess at this, so feel free to correct me if I'm wrong. But that's because there are so many different scenarios with COVID-19.
Agreed. Yeah, absolutely. And if you could have a filter, but if it's not a strong enough filter and viruses or other particles can get through it, then you're not filtering anything that you're worried about.
Interesting. Okay, so here's another one. Shay wants to know, using the hashtag #HeyDoctor, and you can do that on Facebook Live. We're trying to get to as many comments and questions as we can here. But again, we're only able to talk about Thanksgiving, COVID-19. We're trying to put that message out there. And so Dr. Udike can't really speak specifics on, certain scenarios, but and that's just because there's such a broad spectrum of COVID-19 and depending on which part of the community you're in, boy, I mean, we're seeing BB, schools go virtual. And BB isn't dealing with the exact scenario or situation in Little Rock or down in Southeast Arkansas. So we're trying to keep it as broad as possible. Hope you guys understand. But Shay wants to know, hey, doctor, should I get a COVID test before I fly?
So if you get a COVID test before you fly, you would still then be exposing yourself to everyone else that was on that airplane. So the test that you had was true up until the point that you exposed yourself to other people, and then you don't know if you've been exposed again.
And I'm looking at, trying to get through, and again, these questions are coming in so fast here. So here, and this actually kind of goes back to your last comment in Jasmine saying, hey, doctor, would it help if we were to all get tested before our gatherings? Ours would be relatively small.
So if you got tested, then you would have to quarantine yourself in the meantime, because if you're tested and then you end up going out and seeing other people, you now don't know if you've been infected at that point, because there is that incubation time of several days where you could have had a negative COVID test, let's say on Monday, were exposed on Wednesday and hung out with someone on Friday, and you were technically negative Monday, but you could have been positive during that week, but you wouldn't have caught it on that test that you had.
There's this whole thing is just so mind-boggling. I mean, there's so much to process related to COVID.
And just to follow up on that, a good rule of thumb that I follow, my family follows, if you feel sick, stay home. If you're having cold or flu symptoms, stay home. Wash your hands frequently. Try and avoid large public gatherings if possible. And then don't be afraid to ask family members or friends, hey, do you feel sick? Have you been exposed to someone with COVID in the last 14 days? Have you had a COVID test in the last 14 days? And if some of those answers are yes, then maybe you should reconsider being around those people.
Very interesting. And I've thought about this. I was actually talking to my friend last night, and I thought, because every once in a while I'll go to the governor's news conference, or we'll attend it virtually and anchor it here on all of our digital platforms. And I thought, I'm interested in hearing what, certain people in certain positions, what their plans are for Thanksgiving. I did think about asking the governor, what is the governor doing for Thanksgiving? How is he practicing some of the rules that he has set in place? Doc, what are some of your plans for Thanksgiving? Are you keeping the family away because of COVID-19? What are you doing as so many people in the health community say, hey, we might need to hit the brakes on Thanksgiving gatherings?
Yeah, so my family is from Pocahontas, Arkansas, and we won't be going up there this year. I also have aunts and uncles from Nigeria who live here in town, which I have not seen in 7-8 months now. And they have 2 brand new babies, which I'd love to see and hang out with. I've really been diligent about staying away from those other family members of mine who hang out with other people in other circles. I work at a hospital. I'm a higher risk. My family's a little bit older. I don't want to be around my aunts and uncles and potentially get them sick. I have seen my mom and dad, and that's really the circle that I hang out with as far as family.
Gotcha. And you know, I'm sure that that is so many people in the health community are going to be listening to their own advice, given the fact that you guys are in this. You see what's happening every single day at our hospital systems across Arkansas. Of course, hospitalizations continue to rise. We've been reporting that. And I don't want to, you know, get off the train here with questions related to Thanksgiving and COVID-19, but I did see this question come in, and I want to get to it. And I know you can't give directed medical advice over Facebook. Of course, you're a family doctor. People can reach out to you. But Ashley wants to know, hey, doctor, my daughter is currently quarantined because she was exposed last Monday. We found out yesterday. Should she get tested? And if it's one of those questions that, hey, you know, come see me, come schedule an appointment, that's okay too.
Yeah, I do think that is, you can call us at the Family Medicine Clinic. There's other questions I would like to ask or follow up. A good rule of thumb is if you were exposed, stay at home, follow the CDC guidelines or the Arkansas Department of Health guidelines. They lay down exactly what you should do if you are exposed, how long you should stay at home, and if they think you should have a test. You can also call their toll-free number, and they have experts on the phone who will tell you, hey, stay at home this long. If we think you should get tested, come in and get tested. And they can also help you get resources like groceries or medicines if you're unable to leave the house.
So just got to throw this out. Is it safe to say that and you know, I think that I was talking to someone and they were like, you know, 2020 has just been the year. I mean, if you think about it, you know, there's so much being thrown at so many people, and then you throw the holidays now into the mix of a global health pandemic. Is it safe to say that life soon, it may not be next week, it may not be in 3 months, it may not be 8 months, life will get back to normal at some point?
Yes, I agree with that statement wholeheartedly. At some point, we will get back to at least a semblance of normal or a new normal. That doesn't mean that we're forever going to have to wear masks and be 6 feet away, but I think that we're heading in the right direction if we continue to do the right thing now to keep us from having more and more numbers in the future. If we can do what we need to do now, it'll make things a lot better going forward.
Well, and you heard it there from him, folks. At this point, and I'm seeing actually, Doc, you have a producer helping. So Katrina, who helps out in your guys' media department there at UAMS, is saying that people can schedule an appointment. Katrina, all right, hold on. I'm going to break away from, hold on just a sec, folks. I'm going to break away from the Zoom because I don't know if Katrina, I don't know if your name and your ID will come up. Okay, so she says to make an appointment at UAMS, call 501-686-7000. Again, that's 501-686-7000. You can also visit uamshealth.com. So now to go back to the Zoom call. So Doc, I guess that would be the best advice because we are seeing a lot of questions come in from folks who are asking direct questions related to their personal health, and obviously that's not something that you guys like to do over Facebook Live.
Well, we would love to see you, and you can come into clinic, and you can schedule FaceTime or Zoom calls with us too if you would rather stay home. Awesome. And we also have an urgent care if you are having symptoms or think that you need to be tested for COVID. UAMS is still testing for COVID at the drive-through lane, just right below where I'm sitting actually, and you don't have to get out of your car.
Wow, there you go. And I don't know if folks remember, but just a few minutes ago you were talking about wearing that mask, and then we saw a couple people behind you walk behind that door, all of them wearing a face covering. So yes, that's the best advice.
Absolutely. I took mine off to do this interview. I'm in a large open area. They knew that I was doing this, and they just ran past me quickly.
There you go. All right, Doc, I know you're busy. I know that things are still hectic in the medical community. We certainly appreciate your time, and happy holidays. Stay healthy and be
Yeah,
safe.
you too. Thanks,
All right.
guys. You have a good day.
Thanks. And we appreciate that. And for folks, if you missed any part of our live interview today, feel free. It'll be saved right here on Facebook. You can watch it again. And then, of course, KRK.com, Fox16.com for updates throughout the day related to the coronavirus. Just a reminder, the governor is holding a COVID-19 weekly briefing here. In about an hour, we'll carry that live right here on the device that you're watching. But for now, have a good